Health Minister Dr Joe Phaahla has tabled his department's 2022-23 budget before Parliament. It comes in at a 65.4 billion rand. The majority of that is going to go to the provinces, though. 2 billion rand set aside for COVID vaccines. So let's get a sense of how exactly it's going to be spent. I'm joined now by our Health Minister, Dr Joe Phaahla. Minister, thank you so much for your time. Are you happy with how the provinces have been spending the health budget money? And I think, case in point, Chris Hani Baragwanath running out of bread a few weeks ago.
Well, things can be much better. There are quite a number of areas which we would have wished that all of us, national and all provinces, that we could spend all these scarce resources more prudently. Clearly, from the experience of the last few years, there's quite a lot of areas in which there can be more improvement in terms of prioritization. These are very scarce resources. The demands are very huge in terms of services. The burden of disease is huge. And of course, in the last 2 years, and of course still ongoing, even though with less pressure, the COVID-19 epidemic just added to that. So we are working with all the provinces on a regular basis to try and make sure that from our own level over and above the Auditor General, that we do our own monitoring of what we call the non-negotiable areas, which include provision of food, cleanliness, and supply of medicines, just to give an example.
And I'm starting with the Chris Hani Baragwanath hospital situation, because it's the biggest hospital in the country, one of the biggest in the world, in fact. Is it because of a lack of funds? Has money been spent badly or just spent on other things and they've run out of money? Is it squandering of funds, or is it just bad planning, bad administration? Did you get to the bottom of what went wrong there?
Well, it's a combination of factors. The one is the fact that overall there is no denying of the fact that the public health system over a long period has been underfunded. There is no dispute about that fact. But even within that, in many cases, in terms of just, how we prioritize what we spend on, how we spend it, the kind of, people we hire, at what, in terms of those priority areas, front desk personnel over and above top level management positions, also in terms of the things which we procure, what is the priority, essentials and non-essentials, and also sometimes, the evidence has been there also that in some cases it's just pure mismanagement and abuse of the funds. So it's a multiple combination of factors, but I want to underline also that we also don't deny that there is also chronic underfunding, but even with what we have, we believe that we could do much better.
And speaking of that underfunding, how disappointed are you that in real terms your health budget is less, because it is not even keeping up with inflation?
That is a major challenge. We do understand that it's part of the challenge of the country's fiscus. But you see, as the population, increases, as people live longer, and the more people live longer as well, the demands on the health is increasing. So there's a lot of factors which, just means that it's going to be much more difficult. You've got an unpredictable burden of disease already. We carry the highest HIV and AIDS burden, tuberculosis, and other non-communicable diseases, trauma and accidents. All those combined just makes the burden quite huge. So with at least what we have been asking is just, even if based on inflation, if the health budget could just be sustained at the level of even, let's say, 2021-22, of what we have been allocated, that would actually, at least even just catering just for inflation, that would be able to stabilize.
You didn't even get that. You've got to spend 2 billion rand on COVID vaccines. Let's speak, though, about an issue that is a problem every single year. And to some it might seem like a small issue, but I think it speaks to the heart of looking after the people in the system. Every year we hear about medical interns that don't have a place. And every year we hear it's because, oh, they weren't quite budgeted for, we weren't sure about that. And often a plan is made for them at the last minute. Can you reassure us that you've actually got enough budget to place your medical interns? Because after all, they are vitally needed in the health service.
Well, Sally, at least on that point, I'm happy to say to all our final year medical students and also those who are completing their medical internship that come the end of this year, we have come to an agreement with the Treasury and the Minister of Finance. The Minister did announce in his budget speech an additional allocation over the remaining 2 years of 2.1 billion rand, which will be sufficient enough for us to be able to plan and place all the interns in time, and including that will give us space also to deploy all the community service medical doctors. But unfortunately, that's where it ends in terms of a total human resources for health for the country. We're still a lot shorter than what we require. But at least on the interns, I can bet to say this year and next year we will not have a challenge.
And it's interesting you say you've just got less than you require. We know that there were young nurses protesting just a couple of weeks ago because the Covert staff who were employed during the height of the pandemic are being let go. Is that for budgetary reasons?
It is definitely. The reason for that is that, as I mentioned in my speech, that over the last 2 years we have benefited from what was called the presidential stimulus package, when the president announced in June 2020 the 500 billion additional adjustment, which Minister Mboweni did table at that time. Some of it was continued into 2021-22, and therefore our provinces were able to have additional staff to cater for continuing COVID. Now, the Treasury has come back to say, well, with the declining in the pressure on the COVID, we have decanted a number of the COVID additional wards. Some of those have been, taken back to normal service. So those funds have been reduced.
Dr. Phaahla, that suggests that you don't anticipate a difficult fifth wave, which of course we're heading for, whatever we want to call it. We have less than 50% of adults vaccinated. You want to see 70% of adults vaccinated. It has been a point of frustration that we haven't got there. How are you going to make sure we do get there? Because the money has been allocated on those COVID jabs, which are starting to expire.
Well, definitely, that's the sad part of, we've done a bit of what we can do in terms of advocacy, in terms of encouraging younger people to come forward, young professionals, the health professionals who've also come in to add their voice in encouraging, because it's largely the younger people at the level of 60 and above. We're just under 70%, the 50 and above just under 65%. So the problem is the younger generation. And we must admit that at that level, it is definitely frustrating in terms of providing adequate population coverage. So it is a reality that if that doesn't turn around, we'll never reach that 70%. And of course, a major resource, which we fought hard to get from the richer countries, the vaccination, including over 7 million donations. All those may come to waste. And that's very unfortunate because we're not yet out of the COVID pandemic threat. As you said, the fifth wave is still looming large. And we continue to do our best. We ask media and other social partners to really help us in trying to reach people who have not been able to reach.
Yeah, as you say, we've got to keep trying. Thank you very much for joining us this evening, Health Minister Dr Joe Phaahla.